Hearing individuals' lived experiences is really important to understanding these issues. So let's hear from some patients about their previous experiences in medical care.
Hi, my name is Ella, and I'm a rare disease patient, which is what caused my hearing loss. I was born hearing, and they found my hearing loss when I was in 3rd grade. That's also when I got hearing aids. And as I got older, I lost more hearing, which means that I was raised in a hearing world, and because of my rare disease, I grew up in medical settings. I also come from a medical family. My mother, my grandmother, they're both nurses. I have an aunt who used to ride the ambulance before she had 5 kids. And there's also other health problems in my family that have meant that I'm immersed in the medical world. Because I didn't learn sign language until high school, I never had interpreters growing up because I didn't know sign language was a thing. Now that I'm grown and I do use sign language interpreters for my college classes, I still elect not to use them in medical settings because I'm so comfortable there and I know about the policies for communication. When it comes to one person in the room with me, I'm generally fine because I have no distractions. As soon as you add a second person to the mix, it's a lot harder for me to keep track of conversations. When I have gone to the doctor's office, which is almost monthly because of my disease, it has led to some interesting conversations about how I prefer to communicate and why I don't want an interpreter. When COVID happened, because I speak so well, people often forget that I am deaf and I cannot hear what is happening even with my hearing aids. After about 3 months of going to monthly appointments during COVID, I gave up trying to talk to the MA and instead just wrote on my phone, "I'm deaf and here is all of my check-in information," which included things like my name, my address, my date of birth, everything they ask for in order to confirm for appointments. Then when they called me back, I would just watch the door and see if someone would look around after speaking. In all likelihood, they called my name and I didn't hear them. Then I would follow the nurse or the tech, whoever was doing vitals, to the back room. I would tell them, "I'm deaf, are you willing to lower your mask for me? We can stay as far apart as you want." Sometimes they would lower their mask and we'd have a small chat while we were doing vitals. Other times they'd shake their head no and we'd just sit there in silence. My doctors know me very well because of my rare disease, and most of them were quite willing to work with me despite my hearing loss during COVID and the requirements for masks. Some of them would just stand a couple of feet away from me and lower their mask and keep it down for the entirety of the appointment until they were doing some close-up checks. Other doctors refused and they just had to speak up a lot, which I really didn't like, but I was willing to put up with it.
Okay, one time back in 2021, a year after COVID, everyone decided to provide free vaccinations. I got the information about it through my mom. Otherwise, I wouldn't have ever known. Because I am deaf, the communication was not brought to me. I called the phone number for the local vaccine clinic. We worked it out over the phone, what time it would be and where. And then I said, "Make sure you get an interpreter." And they said that they would. But later, when I showed up on the day that I was supposed to, I was a little bit nervous, and I came to the front desk and I said, using my phone, that I'm deaf. And they read what I had to say. They showed me where to go, but I said, "Do you have an interpreter?" In my text on my phone, I said, "Do you have an interpreter?" And they said, "No, we don't." And I thought to myself, I let you know about getting an interpreter, but you didn't. They said that they did finally find an interpreter, and that person showed up about 10 or 15 minutes. After I was supposed to get the test, I got the vaccine. After they asked me questions, I waited about 15 minutes. They wanted to make sure that I felt okay. And I left and everything was fine. I went in for a booster shot, or for the second shot, and I did not have a good experience. The second experience was even worse than the first. They pulled in a hearing person to interpret for me that was not certified. I tried my best to navigate that situation like I did with the first. And luckily I had already experienced the vaccine, so I knew what was going on. And so it ended up being okay.
So my time during the COVID time, I have a hard time trying to understand the doctor because there was no interpreter there. And so during the time there was no interpreter and the doctor tried to talk with me, but it's harder for me to understand them because they have their masks on and I cannot see their lips. And so they were just telling me what to do, what the next step, and just put me everywhere. And I just become lost. And I don't know what I'm doing. I just follow the plan. Follow the flow.
Medical ethics dictate that patients understand their diagnosis and the risks and benefits of treatment so they can make informed healthcare decisions. In order to make informed medical decisions, patients need to have competency, capacity, and be free from coercion. This requires patients to be given health information in a way they can understand. Since many deaf patients use ASL as their primary language, some deaf individuals may have limited English proficiency. To bridge gaps in language comprehension, it is important to provide deaf patients with ASL interpretation services when requested to ensure informed consent. The Americans with Disabilities Act, or ADA, is a federal law that prohibits discrimination against individuals with disabilities, including deaf individuals. The ADA applies to a wide range of areas, including employment, housing, public accommodations, and telecommunications. In healthcare settings, the ADA requires that medical providers make reasonable accommodations to ensure equal access to medical services, information, and resources. This can include providing sign language interpreters, providing written materials in accessible formats, and using assistive technologies to facilitate communication and access to information. By complying with the ADA, healthcare providers and other organizations can help to ensure that deaf individuals have equal access to goods, services, and employment opportunities, and that they are able to fully participate in all aspects of society.
There are three main federal laws that apply to hospitals. The first is the Americans with Disabilities Act. The second is Section 504 of the Rehabilitation Act. And the third is the Affordable Care Act. There needs to be effective communication, and what that looks like depends on the patient and not what HR or the legal department or what the hospital thinks. You should have what they call an interactive process. Sit down with the patient and say, how does communication work for you? What does that look like for you? Do you need an ASL interpreter? Do you need video remote interpreting services? Do you need a cued interpreter? Do you need an oral interpreter? There are a lot of different ways to provide that. So under Title III of the ADA, even though the hospital gets to choose what effective communication will be, they really should talk to the patient and have an interactive discussion with them and find out what that effective communication looks like.